It's amazing how tiny, small, little stones can cause massive pain. I'm talking about gallbladder and bile duct stones. And while these are often overlooked, it can lead to nausea, infection, and if left untreated, even emergencies. But here's the good news. Not all cases need surgery. So on this episode of Good Health with Badr Samaa Royal Hospital, we have with us Dr. Hisham Abdullah Al Dhahab, Senior Consultant Gastroenterologist and Endoscopist. Thank you so much for joining us, Doctor.
Thank you.
So, Doctor, tell me about the symptoms of gallbladder stones and are they dangerous?
That's a very common question. I get it all the time. Bile duct stones and stone in the common channel, common bile ducts, is very common. 30% of the population suffer from it. They may not have any symptoms, so they're picked up incidentally because they're doing an ultrasound or something else. But the typical symptoms is very unique. They have a very excruciating pain, which starts right up here, because the gallbladder is below your liver. Typically starts 1 hour after having a very greasy or fatty meal and tend to travel to the back. Lasts for 1 hour, even more.
And how do we diagnose it?
So once the patient have a pain, which is very typical of a gallbladder stone, the first modality or the first test you do is a simple ultrasound. But sometimes, what these stones can migrate and go to the channel. So in that case, you may need like an MRI or special endoscopies to diagnose the stones that travel to the bile duct.
So, doctor, is surgery the only option or is there another way out?
That's another very good question. So depends. If the stone is just in the gallbladder, then surgery is the only option. But sometimes, as I said, these stones can travel. If they have so many stones and one of the stones travel into the bile duct, they need to refer the patients. We need to see them as a gastroenterologist because we do what is called an ERCP. It's a special scope to remove these stones in these tiny bile duct channels, and then we refer them to our colleagues in surgery to do the surgery at the same setting.
Okay, doctor, this looks very interesting. Take me through the process. How do you remove stones from the bile duct using this?
Okay, so as I said, if the stones travel from the gallbladder to the bile duct channels, we use a scope called ERCP scope. So this is the ERCP scope. Does not involve major surgery. We go through the mouth. We reach a small valve. In the small valve, there's a small opening that allows us to go to the tiny channels. We make a little cut from the inside, and then we use usually our own devices to take it out from the bile duct.
Doctor, we have to agree prevention is better than cure, right? So how do you just prevent gallbladder stones?
Exactly. So simple, maintain a healthy lifestyle, maintain your ideal weight, avoid greasy, fatty food, daily exercise. This is the best way to prevent gallbladder.